Phone three. Okay, three, two, one, let's go. Okay, I will share the screen. I hope that you're doing well and we can start this class. So, Josue, I have a question. When did you finish studying nursing? When did you
Oh,
finish studying nurses? Oh, nursing, sorry.
I had I I had finished my studies on 1 years, 2 years ago.
Okay, no, you had finished studying. No, no, no. You finish studying.
I finished studying.
Because if you say I had finished studying, it means that you are going to give me another action after this. For example, I had breakfast before I had a class. Yo había tomado desayuno antes de que yo tuviese una clase. Cuando tú me usas el pasado perfecto, es para hablar de una situación anterior a otra, pero en el mismo pasado. Por
Mhm.
ejemplo, 7 a.m., I had a class. 7 de la mañana tuve una clase. 8 de la mañana, I had breakfast. 7 a.m., I had a class. 8 a.m., I had breakfast. Te das cuenta que ambas ocurrieron en el pasado, pero una ocurrió antes de otra. Entonces, cuando yo te quiero contar estas situaciones, te diría que I had a class before I had breakfast. Oye, Josué, yo había tenido una clase antes de que yo tomase desayuno. Ambas opciones ocurrieron en el pasado, pero una antes que otro. Cuando tú me dices, I had finished studying nursing. Yo había terminado de estudiar medicina. Yo espero que tú me digas algo, otra acción que ocurre después de esta acción, pero en el
Mhm.
pasado. ¿Se entiende?
Okay. Sí, sí, sí.
Si simplemente me quieres decir que terminaste de estudiar, dime pasado simple. I
Uh,
finished studying nursing 2 years
2 years
ago.
ago. Yeah.
2 years ago. Okay. And why did you study nursing? What was the reason?
Mm, it was because um I don't know, when I was a kid, I used to sell TV shows like emergency. How
Okay.
is emergency call? It's a TV show where show you that how the doctors and the nurses uh, provide the healthcare or the treatment in rare cases.
Okay, like Doctor House or 911, like that.
Uh, it it's more specific. It was in the on Discovery Channel. Yeah, it's an
Okay.
emergency call, like things
Or
like that.
something like that.
Something
Okay.
like that.
Okay. Okay. I see your point. So that was the reason that you study nursing.
It was a part.
Okay.
It's not all, but it's the beginning.
It was the beginning. It
It was
was
the
the
beginning.
beginning. Okie dokie. I see your point. Okay. Let's continue. So now I have some questions for you. Focus on this part. We are going to talk about hospital staff. I mean, what is your staff people who work in the hospital? Okay. So, for
Yeah.
example, so we have the receptionist, the pediatrician, the obstetrician, the surgeon, the cardiologist, and the radiologist. For example, Josue, what does the receptionist do? What does the receptionist do? What does she do?
Mm. The receptionist is the person who make the appointments, give the los recados. ¿Cómo dices los recados?
Can you
Los
repeat?
recados
And
anota, writes
write
the
down, anotar, write down.
write down the the appointment and the studies to have to make. I don't know
Okay, okay, wait a second. Well, the receptionist makes appointments.
makes
The
appointments.
receptionist makes appointments. You see?
Mhm.
Okay. Or you can also, she helps maybe Familiares. How do you say familiares?
Sí,
Helps. Tell me. She helps
familiares.
what? Relatives. Relatives. Okay. Did you understand?
No.
Okay, la recepcionista ayuda a los familiares. ¿En qué sentido? She gives or he gives what? Gives in for,
Information
about what? Or about who? About the pay,
us about the
about,
pedestrian
about the patients, about the
patients.
patients, of course. She or he gives information about the patients. Did you understand?
Uh-huh.
Yep. Okie
Yep.
dokie. So we can continue. What about the pediatrician? The pediatrician, what does the pediatrician do? Do you know what does the pediatrician do?
The pediatrician, it's a doctor who specializes on the on the kids and the children, the whole
Okay.
children,
Okay.
and yeah.
Okay, I see your point. Okay, so the pediatrician is a person who specialize or who is an expert in what? In oral disease or in kids disease?
And kids disease,
And kids diseases. And in plural, we say kid diseases. Okay,
kids
dokie.
diseases.
Nice. That's great. That's great. What about the obstetrician? What does the obstetrician do? What does she do?
Obstetrician also have an expert in the
Okay, they are obstetricians. They are expert in what?
in
They're
the
expert in what?
they take care or
They take
they
care of what?
the they care during, no sé cómo decir,
Durante pregnancy,
antes, durante y después del embarazo,
before, during, and after what?
del embarazo,
The pregnancy,
the
before, during, and
pregnancy.
after the pregnancy. The pregnancy. Okay, so this person is like it takes cares of the pregnant person, of a pregnant girl, right?
Ujú, sí,
Okie dokie. Well, of women who are pregnant, right?
ajá.
Yes. Okay, that's a cool. That's a cool. And what about the surgeon? What does the surgeon do?
Surgeon, he's a person who
It's a person who
who
what?
who
Who
makes
performs? Who performed what?
who
Perform que
performs
realiza.
who performs as
Sir, surgeries.
surgeries,
Surgeries. It's a person who performs surgery. Okay? Surgery.
surgeries,
Easy surgeries or complex surgeries? What do you think? Or
both.
both.
Hay early
Both.
surgeries menores y mayores. No sé cómo.
Minors and major
Minors,
surgeries.
major
That's true.
surgeries.
That's true. That's true. Okay, so now I have a question for you. What jobs do people have in hospital? Can you mention the jobs that people have in hospital? Apart from a receptionist, pediatrician, obstetrician, maybe can you mention five more?
Also the nurse, the people who do the the cleaning, the clean
Mm-hmm.
stuff, the paramedics,
The
the
paramedics. Okay,
paramedics,
it could be.
paramedics, um, the chiefs, ¿cómo se dicen? Pues jefos de las áreas, por
Okay.
ejemplo,
Yeah.
pues el director, el director.
Okay, I'm gonna teach you those words later. And I have a question for you. Which employees do nurses work with most often? Nurses work just with the receptionist? Nurses work with a pediatrician? Or what do you think?
No, I think the nurses or like another person who works in the hospital.
Okay,
They have to work with all the people
with all the people,
because
right?
it's a work team. It's a
Okay, I see what you mean. It's a teamwork. Of course, so
teamwork.
they work with doctors. Okay, they work with doctors in general, pediatrician,
Mhm.
obstetrician, cardiologist. Yes?
Yes.
Okay, so now please look at this. There are many types of jobs that people working in hospital have, from doctors and nurses to cleaning and waiting staff that are needed to clean the public restrooms and run the hospital cafeteria. I believe that nurses work with doctors most often. They are most likely to take everyday orders from them and have to undertake specific responsibilities that doctors give them. There are specific types of nurses for more specialized tasks. What is this verb undertake? I really like the verb undertake. What is undertake?
Undertake.
It says, look at this, and they are most likely to take everyday orders from them and have to undertake specific responsibilities. Undertake in Spanish is like to um, comprometerse a hacer algo. You see?
Undertake. Come on.
Por ejemplo, yo me comprometo a enseñarte la próxima lección vocabulario. So, I undertake to teach you vocabulary. I undertake. Entonces aquí dice, they are most likely to take everyday orders from them and tienen que comprometerse ¿con quién? Con responsabilidades específicas que los doctores les asignan
Dan.
o les dan. You see?
Mhm.
And there are a specific type of nurses for more specialized tasks. You know, there are nurses that can help in a surgery and they work with a surgeon. There are nurses and they can be like a physician, like a doctor. So I'm going to teach you more words. So we have the word doctor. Repeat after me, doctor.
Doctor.
Okay, it's not a or, like doctor. La última no es un tor, sino que tenemos el símbolo de la schwa. Este schwa. La schwa es el
Okay.
símbolo más feo y vago que tenemos, que es el e, e, Acá está. Sería doctor. Suavecito. Mira, la T.
Doctor.
Doctor. Doctor.
Doctor.
Doctor. Nice. Y
Doctor.
tenemos el verbo diagnose. Diagnose, que viene a ser
Diagnose.
diagnosticar, diagnose, and treat,
Diagnose.
treat, tratar a los
Treat.
pacientes debería ser treat, treat.
Treat.
Ahora, ¿qué símbolo fonético tiene el de la I minúscula, o sea, el de la I chiquitita? O sea, que es treat, treat,
Treat.
que significa tratar, treat. So, the
Treat.
doctors diagnose and treat patients. ¿Cómo
Treat.
se pronuncia pacientes? Pacientes es ¿qué?
Patience.
Patient, patient. Ahora también tiene la schwa.
Patient.
Patient, patient,
Patient.
patient, 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 patient. You see?
Patience. Yes.
Nice. Ahora tenemos nurse. Nurse is para men and for women. Okay? It can be for a boy and for a girl, for men and for women. Nurses provide care. Provide, otro verbo I need you to remember. Brinda, provee, provee
Provide.
care, cuidado, and es support or
Support.
support. Es el verbo support.
Support.
Support. And what is support?
Como
Apo
apoyo.
apoyo, support es que te apoya, ¿ok? ¿Y quién apoya? To patients. ¿Te das cuenta que el verbo support, cuando va a apoyar a alguien, mm, de que puede ir con el tú, sí. Por ejemplo, I support people, yo apoyo a las personas. La verdad que el support yo no le veo necesario que le agreguemos el tú, ¿ok?
Okay.
Pero depende mucho. Por ejemplo, ¿cómo decirte? Es que support, aparte de apoyar, o sea, emocionalmente, de dar ánimos, esas cosillas, también significa proveer, o sea, mantener. Por ejemplo,
Mhm.
my mother supports me. Mi mamá me mantiene, o sea, financiera o económicamente. ¿Estamos de acuerdo? A eso
Okay.
voy con el support. Para que quede más claro, estaría bien que le agregues el tú. I support two people. Podría ser, la verdad. Yo no le agregaría la palabra tú. ¿Ok,
Mhm.
José?
Okay.
¿Ok? Pero ¿qué pasaría con el verbo provide? Provide significa brindar, que provee. ¿Ok? Y tampoco no le veo la necesidad de agregarle el tú, así que en este caso lo voy a borrar. Entonces yo diría como que nurses provide care and support patients. Así lo
Patience.
dejaría yo. And support patients. ¿Se entiende?
Okay.
Okie dokie. What about the surgeon? Mira, surgeon, surgeon. Ahora, enfermero
Surgeon.
no tiene nada que ver con la U, no es nurse, es tipo una E mediana. Sería nurse,
Nurse.
nurse, nurse.
Nurse.
Okay.
Yep.
Please read the sentence.
Nurse provide care and support patients.
Exactly. Exactly. So surgeons performs operation. I mean surgeon. Read the sentence here.
Surgeons.
Surgeons, los cirujanos realizan,
Surgeons
miran,
perform
realizan
operations to treat injuries or illness.
illnesses,
Illnesses. Illnesses.
illnesses.
Okay.
Okay.
Surgeons perform operations to treat injuries or illnesses.
Ok. Okidoki. Continuemos. Y luego tenemos el anesthesiologist. Anesthesiologist, que viene a ser el anestesiólogo. Ok. Y dice administrar. Mira, no es que te voy a poner put anesthesia. No, tienes que administer.
Administer.
Administer anesthesia. No es que se pone do operations o do surgeries. No se utiliza la palabra do. Se utiliza el verbo perform.
Perform.
Perform. No sé si te das cuenta. Esto es crucial para que puedas seguir, bueno, en contexto, ¿no? Voy a ponerle con otro colorcito. Por ejemplo, aquí tenemos el diagnose. Aquí tenemos el verbo treat, que yo necesito que ya vayas conociendo. El verbo provide. El verbo support. El verbo maybe here perform. Son verbos que ya tienes que ir conociendo. Treat, mira, una vez más, para tratar injuries or illnesses. Y luego tenemos administer, que vendría a ser administrar. Did you understand?
Yep.
Okay, so it's important that you remember these verbs. So let's go very quickly because then you will find this information on the platform. We have the radiologist, the pharmacist, we have the physical therapist,
Therapist.
the occupational therapist, then we have the lab technician, the health administrator, the medical assistant, the social worker, the dietitian, the emergency medical technician, and the psychologist. Okay, I know that there are more. There are more.
Mhm.
There are more, but these are just really important. So for our first lesson, it's important that you get familiar with those words. Okay.
Yep.
So I will call you very quickly in Spanish, and I want you to pronounce it in English. Okay. Three,
Okay.
2, 1, start. Doctor,
Doctor.
enfermero,
Nurses.
cirujano,
Surgeon.
anestesiólogo.
An anesthesiologist.
Ok, es A,
Anesthesiologist.
repite conmigo,
Anesthesiologist.
anestesiologist. Anesthesiology. Anesthesiologist.
Anesthesiologist.
A ver, repite conmigo.
Anesthesiologist.
Es tathesisosu. Tathesisosu. I'm sorry. Anesthesiologist.
Okay.
Anesthesiologist. Inténtalo.
Anesthesiologist.
Uy, me gustó bastante.
Anesthesiologist.
No. A ver, repite conmigo.
Anes.
Ahora dime. No. Es anes normal.
Mhm. Anes.
Anes. Vale, ahora
Anes.
dime. Physiologist.
Physiologist.
Anesthesiologist.
Anesthesiologist.
Me gustó mejor. Radiólogo,
Radiologist.
farmacéutico,
Um, Pharmaceutic. Explica igual.
pharmacist, pharmacist,
Pharmacist. Pharmacist.
pharmacist, fisioterapeuta,
Physiotherapist.
physical therapist,
Physical
physical
therapist.
therapist. ¿Ok?
Physical therapist.
Terapeuta ocupacional,
Um, Assistant.
occupational therapist,
Occupational therapist.
occupational therapist. Técnico de
Yes.
laboratorio,
Lab technician.
lab technician, lab technician.
Lab
El
technician.
administrador de salud es aquel que, como tú lo mencionas como un director, quien dirige, eres el health
Call administrator.
administrator, health administrator.
Administrator.
El asistente del médico,
Assistant medical.
medical
Medical
assistant.
assistant.
El
Medical
trabajador
assistant.
social,
Work social. Social
social
worker.
worker. El dietista,
Dietist.
dietitian,
Dietitian.
dietitian. El,
Dietitian.
el técnico de emergencias médicas. Emergency
Mm,
medical technician. Emergency medical
emergency
technician.
medical
Y la
technician.
última, el psicólogo,
Psychologist.
psychologist. Psychologist. So it
Psychologist.
is important, Josue, that for our next session you remember these jobs, okay, or these positions in a hospital, okay?
Mm-hmm.
Okay, let's continue. Now, where do you need to go? Read a hospital directory, then choose what is a directory? What is a directory? Do you use a directory?
No, 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 no. No, yo aquí no. Pero es como pues una guía de dónde están las personas, pues básicamente dónde se ubican.
Exactly. Exactly. I remember that long time ago we used to have directories with telephone numbers. With telephone
Mm.
numbers, they call yellow pages. Do you remember yellow pages? No.
Sí, creo que sí, 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 sí.
It was like long time ago, but nowadays and all the information is on the internet, so nobody is giving like a yellow pages or blue pages. So now it says read a hospital directory, then choose a correct answer. My question is, what is the purpose of this document? Analyze the document and tell me what is the purpose of the document.
It's to helping people find hospital stuff.
Is to, could you just repeat, is to,
It's to helping people to find. Like, no habría un to find.
is to find, but there are options.
Okay, find people stuff. Or
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 what?
or also the letter D. It's to provide employees contact information.
That would be great. That would be great. That would be great. For me, for example, I guess that the answer is letter C, helping people find hospital staff. That's true. ¿Qué es el
Ujú.
staff?
Es como
El
um,
personal. El
el
personal del
personal,
hospital. Entonces, ayudar a las personas a encontrar el personal del hospital.
vital.
Who is best qualified to examine a sick 5 years old? Mira, sick 5 years old. A receptionist, a lab technician, a pharmacist, or a pediatrician.
A pediatrician.
A pediatrician. What can you infer about patients being prepared for heart surgery? What can you infer about patients being prepared for heart surgery? They see the general surgeon last. They are treated by Dr. Gupta. They have their operations on the first floor, or they must visit doctors on multiple floors.
It's with the Dr. Leslie Gupta. Gupta
They
is
are treated by Dr. Gupta. That's true. They are treated by
she's
Dr. Gupta.
gorgeous.
Yes, letter B. So 1C, perfect. Number 2D, perfect. And number 3B. Okay, vocabulary. So I want you to tell me the answers.
Lab technician. It's
What is lab technician?
advanced person prepares person imagine to make especially it's who it's who a person who analyze samples one
Okay, the lab
samples
technician, you say letter, this is letter, is a person who analyzes sample. Okay, this is gonna be letter
samples
D.
the
Who is the surgeon? Who is the surgeon?
surgeon
Who is the surgeon?
surgeon is the person who performs uh I don't say open body a person who cuts open the body in operations
Okay, it's a person who cuts
cuts
open the body
in
and in
operations
operations. This is letter E. Okay, who is the anesthesiologist? Who is the anesthesiologist?
anesthesiologist
Yeah, who is the anesthesiologist?
is a person who prevents patient from feeling pain.
Is a person who prevents patient from feeling pain. Okay, focus on this part. Me gusta mucho el hecho del verbo prevent. Recuerda que
Prevent.
prevent significa evitar. Prevent
Mhm.
means evitar. Pero ¿cuál es la diferencia con el avoid? Porque avoid es evitar. Por ejemplo, digo, I avoid eh, people, I avoid maybe eating fast food. Yo evito comer comida rápida. Pero cuando quiero editar a otra persona, digo, I prevent my son from eating. fast food. Con el avoid evito solamente yo o alguien evita algo, pero con el prevent puede hacer que otra persona, yo puedo hacer que otra persona evite otra cosa. Por ejemplo, yo evito que mi hijo coma comida rápida. ¿Se entiende?
Sí, es como para terceros.
Exactamente. Let's continue.
Ok.
Continuemos. So we have F, number 4, pharmacist. Who is the pharmacist?
Pharmacy is a person who prepares drugs and medicine.
Who prepares drugs and medicine? The radiologist. Who is the radiologist?
Radiologist is a person who uses imaging technology.
Imaging technology. And so this is letter B. And the receptionist.
Is a person who welcomes visitors and answers phones.
And answer phones. This is letter G. And the cardiologist, last but not least, is the
The C.
heart specialist. So let's check the answers. 1D, 2E, 3F, 4A, 5B, 6G, 7C. Perfect, Josue. That's great. Let's continue. Fill in the blanks with a correct word and phrase from the word one. We have a pediatrician, we have the obstetrician, and we have the general practitioner. So number 1, what do you think? Analyze.
It says and observes and treats pregnant women until they give birth. It's a obstetrician, an obstetrician,
Obstetrician.
obstetrician.
Number 2,
Parents often take a long time to choose their child's
pediatrician is a
pediatrician,
pediatrician. And
pediatrician.
number 3,
For small problems like a cold, see a general practitioner
a general
instead of us.
practitioner. In Spanish,
Es
in
como
Spanish,
médico general, ¿no?
exactly, is the general practitioner, is the general.
Okay,
No, it's
yeah.
general doctor. No, no, general doctor is the general practitioner.
Okay, yeah.
General practitioner. Okay, before you go, for example, a cardiologist, you go to the general practitioner, and the general practitioner is like a doctor, but this person is not an expert in a field. It's not like expert in hearts and women, you know, like a cardiologist, like a neurologist, like a nephrologist. You see?
Ujú. Sí, sí, sí.
Next part. So please, Josue, listen to and read the hospital directory again. And where can you pick up your medicine from? La pregunta es, where can you pick up your medicine from? Because you pick up your medicine, okay? Listen and read the hospital directory again. So I'm going to show you the image and before you answer these questions. I'm sorry. Hey, what's going on here? It's not working. Wait a minute. Okay, now I think you can see it. Can you hear? Okay, 3, 2, 1, go. Listen.
ESB, Nursing, Book 1. Unit 1, Hospital Staff. Exercise 5, page 5.
Where do you need to go? Mercy Heart Hospital Directory. First floor. Robert Gibbons, receptionist. C4, visitor information, main lobby. Dr. Frank Fabrizio, radiologist. C4, X-rays, MRI scans, room 113. Lisa Kirby, lab technician. C4, analysis, test results, room 125. Susan Devlin, pharmacist. C4, prescription drug pickup, room 129. Second floor. Dr. Leslie Gupta, cardiologist. C4, heart disease, heart surgery, room 231. Dr. Terry David, pediatrician. C4, children's health, room 200. Third floor. Dr. James Lotner, anesthesiologist. C4, surgery, pain relief and preparation, room 312. Dr. Stacy Walters, chief surgeon. C4, surgical procedures, room 323. Fourth floor. Dr. Jared Cho, general practitioner. C4, general medicine, room 403. Dr. Regina Beverly, obstetrician. C4, pregnancy, room 408.
Okay, so Josue, as you can see here, we have the RM. RM stand for what?
Room.
RM stand for one. The room, right?
Your room.
Okie dokie.
Okay.
And also we can say the procedures, right?
Uh,
The procedures. What does it mean? It says C4, C4, C4. What is C4? What information do you
C4.
get when you say C4?
C4 is like pues para ver o
Para ver qué cosa, surgical, para
para
ver general
ver.
medicine. Yeah, it's like maybe the cause of your visit, right? La
Mhm.
causa de tu visita. Okay, mira, C4 analysis and tests go to the lab technician. So my question is, where can you pick up your medicine from?
Okay, if I were in that hospital, I
Who is the
could
person in charge in the room? Tell me the room and the person in charge.
I could go to the room 129 with
129, and
with
who is
the
the doctor?
pharmacist,
Susan.
Susan Duplain.
With Susan, of course. That's true.
Aquí sería primero el nombre y después es su especialidad, o es primero especialidad y después el nombre.
You can say Susan Devlin. Susan
Susan
Devlin, or
Duplain.
you say Dr. Susan Devlin. It's okay.
Okay.
Okay, it's okay. You say Dr. Susan Devlin. Let's continue.
ESP, Nursing,
Okay,
Book
so we
1.
have here. You can pick up your medicine from Susan Devlin, the pharmacist, in room 129.
Exercise 6 and 7, page 5.
Please listen to the conversation between a nurse and an obstetrician. Mark the following statements as true or F for false. Okay, please pay attention. 3, 2, 1, go.
Excuse me, Dr. Beverly. Hi, I'm Mark. I'm a new nurse here.
Hey, Mark. What can I do for you?
I have these x-rays for Dr. Cho's patient. He wants Dr. Fabrizio to take a look at them.
The radiologist? He's on the first floor somewhere.
Do you happen to know the actual room number?
No, but the receptionist in the lobby will.
Okay. This hospital is so confusing.
I know the feeling. You'll get used to it.
Do you want to listen again, or is that okay for you?
No, it's okay.
It's okay. So my question is, the man needs to look at an X-ray, or not? Is that true?
The man, I think the radiologist, yes, but the nurse, no. So it's confused to me. But the man needs to look at their area at
Man needs to look at the
X-rays.
X-rays. Dice como que el hombre necesita ver los rayos X. True or false?
No, false.
False.
It's
Okay.
false.
The radiologists work on the third floor.
It's false. She
False.
says, what she say? It's not say. She not say chair. No.
Okay, it's not. The answer is not there. Maybe in a different one.
False.
And the woman directs the man to the receptionist.
Yeah, it's true.
That is true. I totally agree with you, because that is the answer. Okay, that is the answer. Let's continue.
Exercise 6 and 7, page
One
5.
false, 2 false, and 3 true. Okay, listen again the conversation, Josue. But this time, try to complete the conversation with the words that are missing. Okay, try to complete the words here again. Okay, 3, 2, 1.
Exercise 6 and 7, page 5.
Excuse me, Dr. Beverly. Hi, I'm Mark. I'm a new nurse here.
Hey, Mark. What can I do for you?
I have these x-rays for Dr. Cho's patient. He wants Dr. Fabrizio to take a look at them.
The radiologist? He's on the first floor somewhere.
Do you happen to know the actual room number?
No, but the receptionist in the lobby will.
Okay. This hospital is so confusing.
I know the feeling. You'll get used to it.
Okay, so the first word, what word is missing?
It's the nurse.
The nurse.
Nurses.
The nurse.
Nurses.
That's great. Number 2, what word is missing there?
Yeah, I have this X-rays.
X-rays. That's great.
X-rays.
Word number 3.
Easy to look at them. The radiologist.
The radiologist. The radiologist. Number 4.
Do you happen to know the actual number room or room number?
Room
Because
number.
Room
Room
number.
number, the room number.
Room number.
Number
Room number.
5, what do you think?
No, but the
The
receptionist.
receptionist, I agree.
Receptionist
And
on
number
the other
6,
one. Okay, this hospital is so
it
confusing.
is the hospital. Okay, it is the hospital. So now let's analyze
Exercise 6 and 7. Exercise
let's analyze a vocabulary. Say, excuse me, Dr. Beverly. Okay, excuse me. Excuse me. What is the difference between excuse me and I'm sorry? You say excuse me or I'm sorry, doctor. What's the
Mm,
difference or what do you think?
excuse me, es como si tú, bueno, a lo que yo tengo es como pedir, como una entrada, no sé.
Okay, the difference is very simple, Josue. If you feel guilty, you say, I'm sorry. If not, you say, excuse me, excuse me, excuse me. Okay?
No,
Hold on a second, please. Hold on a second.
ok.
Okay, can you hear me well now? Yes. Okay.
Yeah.
When you feel guilty, you say, I'm sorry, because if you don't feel like that, you say, excuse me. For example, I am walking, and then this is a person like, oh, I'm sorry, because I feel guilty. But for example, I want to participate in a conversation. I never say, I'm sorry, I want to participate. No, you say, excuse me, I want to participate. And in this case, of course, you are a nurse. You don't feel guilty, but you want to be very polite. You want to be very polite. So you say, excuse me, because it's a good way to say, un ratito, you see what I'm saying?
Sí, ya, ya. Sí, 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 un
Si te
minuto.
sientes culpable de algo, dices, I'm sorry. Yo estoy caminando y le golpeo a alguien y le digo, oh, I'm sorry, it wasn't my intention. Cuando tú eres un enfermero, cuando tú eres un profesor, cuando eres alguien, quieres participar, no vas a decir, I'm sorry, disculpa, o sea, no sientes culpa. Simplemente quieres interrumpir y dices, excuse me, pero tienes que usarlo para sonar polite. Porque si de la nada hablas, te ves un poco rude, un poco grosero, un poco malcriado. You see?
Ujú,
En
yeah.
este caso es, excuse me, Dr. Beverly. Un ratito, Dr. Beverly, es una muy buena opción para interrumpir. Es, excuse me, Dr. Beverly. And hi, I am Mark. I'm a new nurse here. Hey, Mark, what can I do for you? Me gusta mucho la expresión, what can I do for you? Es, oye, ¿qué puedo hacer por ti? ¿Ok? What can I do
Ujú,
for you? No es como en español que nosotros decimos, ¿en qué soy bueno? No, no en qué soy bueno. Es, ¿en qué puedo ayudarte? No, what can I do for, ¿qué puedo hacer por ti?
What can I
Puedes
do for
usarme un,
you?
how can I help you?
How
¿Cómo
can I
puedo
help
ayudarte?
you?
How can I help you? The tree, I don't know how to say this. The way that doctors communicate in the US is different from in Latam, for example. In Latam, doctors, and especially for the public health, everyone is bored, everyone is mad. I know this is because of the payment, this is because of the maybe the infrastructure, but the doctors are different from the US, okay? El trato con los
Okay.
doctores en Estados Unidos es totalmente distinto a los que conocemos en Latam, por ejemplo. But it depends, of course, depende de la estructura, depende de who are you talking to. Y le dices, oye,
Ujú,
how can I help you? ¿Cómo puedo ayudarte? I have these x-rays for Dr. Chu's patient. He wants Dr. Fabricio to take. Recuerda que es I want to play. ¿Qué significa I want to play? Yo quiero jugar. Pero ¿qué pasa si yo quiero que Josué juegue? Digo, I want Josué to play. You see, Josué?
okay.
I want to play es para mí nada más, pero de repente quiero que alguien más juegue. Digo, I want Josué to play.
I
Did you
want to
understand?
play. I want to.
Se
Yeah.
dice, yo
Okay.
quiero que el doctor Fabricio le dé una miradita a estos rayos X. The
Okay.
room number, he's on the first floor. Para que me indiques, cuando tú me indicas el número de piso, tienes que usarme siempre la palabra on, el preposición on. You
On.
never say in or at. No, we never say that. We say on for the number of the floor. You see?
Okay.
El somewhere es como por alguna parte del primer piso. He's on the first floor somewhere. Está en el primer piso, sí, pero por algún lugar. ¿Se entiende? We don't know
Mhm.
exactly. We don't know it exactly. Me gusta mucho la pregunta, do you happen to?
Do you happen to?
Do you happen to? El do you happen to es como que en español, oye, de casualidad, no, y continúas. Por ejemplo, imagínate que yo te digo, oye, de casualidad no tienes un cuaderno adicional. Te digo, do you happen to have an extra book, or an extra notebook, an extra pen? Oye, de casualidad no
Chopin.
tienes un lapicero adicional. Oye, de casualidad no sabes el actual room number. ¿Te das cuenta? De
Sí.
casualidad no sabes el número del cuarto real. It's no, but the receptionist in the lobby will. Okay, this hospital is so confusing. I know the feeling. You'll get used to it. Recuerda lo siguiente, en inglés tenemos la expresión used to. Used to, que normalmente le agregamos un verbo y es para indicar que solía. Por ejemplo, I used to play soccer. Yo solía jugar fútbol, que ahora yo no juego, porque yo solía, es tiempo pasado. I used to play soccer. Yo solía, ahora yo no juego. Si quiero decir usually, es usualmente. O muchas personas he notado que dicen suelo. Yo suelo hacer tal cosa. Por ejemplo, I usually, I usually play soccer. En presente, yo usualmente juego fútbol o yo suelo jugar fútbol. ¿Se entiende? Tenemos el used to y el usually. Hasta aquí hay preguntillas.
Usually
Do you have-
play soccer.
No. Esto es para
Ujú.
present simple y lo otro es siempre para el past.
Sí.
¿Por qué? Porque es yo solía, ¿ok? Ahora, tenemos en inglés el be used to y luego tenemos el get used to. Vas a utilizarme el be used to cuando estás acostumbrado. Y el get used to, que significa que te acostumbrar. Por ejemplo, te digo, I am used to English. Yo estoy acostumbrado a que estoy hablando a English speakers. Yo estoy acostumbrado a hablantes del idioma inglés. O también podría decir, I am used to speaking in English. ¿Qué significa? Que estoy acostumbrado a qué?
Hablar
A hablar
inglés.
inglés. Si quieres ponerlo en el pasado, le cambiarías este am por este was, o sea, no hay ningún problema.
I was.
Exactly. O sea, ya depende de ti. Siempre y cuando me coloques el verbo be es lo más importante. I was used to. Yo estaba acostumbrado a hablar en inglés, but not now.
Mm,
Si quieres
okay.
decir que te acostumbras, dirías I need to get used to speaking.
I need
Yo
to get
necesito
used.
acostumbrarme a hablar. O sea que aquí todavía no tienes la costumbre, pero aquí ya estás acostumbrado. ¿Se entiende? Entonces acá dice, oye, tú te acostumbrarás a ello. ¿Se entiende?
Sí,
Genial.
enterado.
Okay, for example, are you used to something? Are you used to something? Use a verb.
Mm, mm, like what? Like I am used to
You
see
are
TV shows
you are used to you're
in
used to
the
watching because see is different. You say watching.
yeah,
I am
yeah,
used to
yeah.
watching TV
I
shows
am used to watching TV shows and at the night,
at night, at night,
at night,
at
at night.
night. Okay, and you want to get used to something? Get used to.
Yeah, I recently I started
Ajá,
to
recientemente he comenzado a qué?
I started
To
to get
get
to get
used to get used to.
used to I don't know if it is say play or it's say
Playing.
to
Playing.
play
Recuerda después
play.
del yusta, del get yusta, el yusta, tiene que ser be yusta. Después del get yusta, todos los verbos van con ing. Pero si
Okay,
solamente me pones el yusta solito, el verbo va normal.
but
¿Ok?
I get used to playing. I don't know how you say la cuerda.
De la cuerda, the rope.
Sí, pero brincar la cuerda.
A jump the rope, the jumping rope. Dice que yo me acostumbro a jugar la cuerda saltarina, ¿cierto?
Ujú.
Pero acá dice yo me acostumbro. ¿Quiere decir que tú te acostumbras o de repente tú intentas, you try to,
I
bueno,
try to.
intento acostumbrarme, ¿te das cuenta?
I try to. Okay, yeah.
O de repente tú dices, I want to. Recuerde que el one, get, I want to get used to speaking in English. Oye, ¿sabes qué? Quiero acostumbrarme a hablar en inglés. O sea, ya puedes usarme este
Want
tipo
to
de
get
estructuras.
used. I
Okie
try to
dokie.
get. Okay, okay,
So
okay.
now let's read the conversation. You are the nurse and I am the obstetrician with your best pronunciation, okay? Three,
Okay.
two, one, go.
Excuse me, Dr. Beverly. Hi, I'm Mark. I am new nurse here.
Hey, Mark, what can I do for you?
I have this X-rays for Dr. Cho's patient. He wants Dr. Fabricio to take a look at him.
The radiologist? He's on the first floor somewhere.
Do you happen to know the actual room number?
No, but the receptionist in the lobby will.
Okay, this hospital is so confusing.
I know the feeling. You'll get used to it. This great pronunciation, Josue, great pronunciation. I need to memorize the word do you happen to. Esta expresión do you
Do you
happen to es
happen
bastante
to?
común. Oye, de casualidad tienes, oye, de casualidad viste, de casualidad tal cosa.
Okay.
Utilízame. Por ejemplo, el de casualidad viste la película en el pasado sería algo como Did you happen to
Did
see
you
Pepita?
happen?
Oye, de casualidad viste a Pepita yesterday. ¿Te das
Do
cuenta?
you
Oye,
happen to see Pepita? Okay.
yesterday, you see?
Yes, sir. Okay. Okay, okay, okay.
Okay, next part. Speaking with a partner, act out the role below based on task 7. Switch role. I'm a nurse here. I have this. He's on the third floor. You want to find someone. Okay, we're gonna do the same activity, but we are going to improvise.
Okay.
Okay? You are always a nurse, but you can change, for example, Dr. Chow, you say doctors Lopez patient, like doctors Ramirez patient, and change the number of the floor. You can also change, for example, I don't know, maybe x-rays. You can also say these test, this analysis, this information, this history, whatever you want. Okay.
Okay.
Okay, so let's start.
Um, I sorry about that.
Yeah, you're the nerd.
Um, excuse me, Dr. Aplaya. Hi, I am Josue. I am new nurse here.
Hey, Josue, what can I do for you?
I have these histories
Mhm.
and 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 I can get the for whom it is for whom there is
What do you
there
want to
are
say? What do you want to say? You?
como que tengo estos historias clínicas, pero no sé de quiénes son, o sea, no tienen
Okay, so
nombre.
I have this history, but I don't
I
know.
I don't
I don't
know
know. Ahí está, pero yo no sé, mira. But I don't know. I don't know de quién, ¿cierto?
de quién
¿Cómo
es,
sería de
como
quién? Whose? I don't
whose
know de quién. Whose?
whose
Whose?
it is.
Whose, por ejemplo, mira, vamos con una pregunta porque esta de aquí se llama indirect questions. Mira, ¿de quién es esta casa? Yo diría, whose house is this, right?
Ujú.
Entonces, por ejemplo, ¿de quién es esta casa? ¿Cómo dirías, por ejemplo, de quién es este perro? ¿De quién es ese perro?
Whose is
Whose dog
whose
is
dog
is
is
that?
this?
Whose dog is
That
that?
is that is that
Entonces, yo no sé de quién this history clinics sería whose these histories are. ¿Te das cuenta?
are okay.
Yo no sé, but I don't know who these histories are.
These histories are.
Okay, so are you looking for maybe the general practitioner?
Yeah, yeah, the dinner practitioner.
Okay,
I don't know.
where is he? Do you know where he is?
Actually, not.
Okay.
I don't know.
Okay, he is on the second floor. He is on the second floor.
Second floor.
Pregúntame si yo sé su nombre. A ver, pregúntame. Oye, Carlos, ¿de casualidad sabes su nombre?
Oh, excuse me. Again, it's me again. Do you know
No,
what
do
is?
you happen to know? Oye, de
Uh,
casualidad, ¿sabes?
do you happen to know what is his name?
Ok, do you happen to know? Mira la pregunta que me has hecho. Mira, mira, tú dices, do you happen to know? Do you happen to know what is his name? Ya, mira, cuando tú me haces este tipo de preguntas, te das cuenta que hay como que dos preguntas, ¿no? En el do you happen to know y en el what is his name, ¿cierto?
Mhm.
Es que literalmente me estás usando dos preguntas. Dices, oye, ¿de casualidad sabes cuál es su nombre? Se te das cuenta que me estás dando dos preguntas. Lo ideal es que ¿cuál es la pregunta principal? ¿La uno o la dos?
La
La uno, porque es como inicia la
uno.
pregunta, o sea, es todo el enunciado.
Sí,
Entonces, lo que tú
sí.
tendrías que hacer es hacer lo siguiente, sería, do you happen to know what his name is? ¿Te das cuenta? Es lo mismo que hemos hecho aquí. Porque aquí tú tenías que haber puesto, but I don't know whose are this history, de quiénes son estas historias, pero no, es que cambiarlo, el orden. Sería, what is his name? No, what his name is. ¿Se entiende, Josué?
Sí, ok.
A ver, te voy a
Sí,
dejar
sí.
algunas preguntitas. Por ejemplo, mi nombre, ¿cómo se pregunta? ¿Cuál es tu nombre? What is your name?
Name.
Quiero que le preguntes a ella, oye, ¿sabes cuál es su nombre? ¿Cómo dirías? ¿Sabes cuál es su nombre?
Do you happen to know what what your what name no what your
What,
name
what your
is?
name
What your name
es
is?
como que tú me digas, oye, ¿de casualidad sabes cuál es tu nombre? No, sería what her name is.
What
¿Cuál
her
es su
name
nombre
is?
de ella? Por ejemplo, para preguntar la hora se dice, what time is it?
What time
¿Cómo
is it?
dirías? Oye, ¿podrías decirme qué hora es?
Um, could you tell me what
Could you tell
time?
me? Muy bien.
Could you
Could
tell
you
me
tell me
what
what
time
what
it
time
is?
it is? Could you
It
tell me what
is.
time it is?
It is.
Porque ya me estás haciendo la inversión. Acá tú también me quieres invertir el orden, pero la invertiste aquí adelante ya. Ya no es necesario que lo inviertas atrás. ¿Te das cuenta?
A ver, esa parte me la puedes repetir, por favor.
Ok, mira, nuevamente yo te pregunto, what time is it?
Ajá.
Aquí me la inviertes porque esta es la pregunta principal. Pero cuando te pregunto, oye, ¿podrías decirme? Could you tell me? Ahí ya estaría la pregunta terminada. Oye, ¿podrías decirme, pero qué cosa quieres que te diga? Ahí está la inversión, el could you. Te dirías, what time it is. Oye, ¿podrías decirme qué hora es? No me puedes
Mm,
decir what time it is. Así, what time is it? ¿Por qué no se puede? Porque es como si me estuvieses usando dos preguntas. Mira, aquí terminaría una pregunta y luego saltas a la otra pregunta y es bien raro. Dice, oye, ¿podrías decirme qué hora es? No, ¿podrías decirme qué hora es? ¿Te das cuenta? Así que por esa razón se tiene que cambiar el orden. A ver, te voy a dejar una más. Por ejemplo, para preguntarle de dónde es alguien, se dice, hey, where are you from?
from.
Quiero que me preguntes, oye, ¿sabes de dónde es ella? ¿Cómo diría eso? ¿Sabes de
Okay.
dónde es ella?
Do you happen to know
Do you
where
happen to
is?
know? Happen to know. Okay, do you have... Oye, de casualidad, ¿sabes?
Do you happen to know where from
Where?
here here is?
Can you repeat? Where? ¿Sabes de dónde?
Where from here is?
Where from she is. Así.
She's
Ok, la respuesta es where from she is. Así.
she's.
Where she is from. Sería, hey, do you happen to
Oh,
know where she is
okay.
from?
She's from.
¿No ves que sería where is she? No, es where she is from. ¿Se
Okay.
entiende? Siempre me tienes
Where you
que
from?
dejar literalmente como debería de ser en inglés, pero, perdón, en español, pero solamente que ahora le pones así. Una más,
Mhm.
una más. Por ejemplo, te digo, and why, why did she killed? Uy, esta es otra. Oye, ¿por qué ella, she killed Pepito? Oye, ¿por qué ella mató a Pepito? ¿Por qué ella lo
Mhm.
mató? Y tú le dices, oye, ¿puedes decirme por qué ella mató a Pepito. ¿Te das cuenta? Entonces, ¿cómo dirías eso?
Sería como, oye,
Can
will
you,
you, can you tell me?
can
Can
you
you
tell
tell me?
me
Can you tell me why,
why? Can you
why
tell me why
she killed
she
Pepito?
killed? Muy bien, she killed Pepito. ¿Te das cuenta que en ningún momento me estarías diciendo, can you tell me why did she kill Pepito?
Ok, creo que si lo pienso como en español, la segunda pregunta creo que es más fácil.
Ah,
En español.
exacto, en español, pero se escucha bien raro. Es como decir, ¿puedes decirme por qué ella
Ujú,
mató a Pepito? Es como que tú me hablas en doble pregunta. ¿De que se puede? ¿Se te entendería? Se te entendería, sí. Pero lo ideal es la primera, ¿no? Que se le conoce como indirect questions.
ok,
¿Vamos bien?
yeah.
Vamos a seguir practicando. Vamos a seguir viendo eso más adelante, así que no te preocupes. Listo. Ahora, use the conversation from A to fill out the entries in the hospital directory. Tenemos aquí name, job title, job duties, name, job title, duties. It is not necessary because we are not in a face-to-face class. Let's continue. Hospital department. So now we know, for example, the hospital staff, right? We know the hospital staff. So now
Ujú.
I want to talk about a little bit about the hospital departments. So the first question for you is, what services do patients get in different hospital departments? Do you know the services?
Yeah, it's a ver, bueno, pues es inherente a ¿cómo dicen? A las especialidades. Entonces
Okay.
es con el Department of Radiology, of Surgery, of Cardiologies, sí, things like that.
Or the cardiology cardiology department. Le conocemos
The
como
Cardiology
cardiology
Department,
department. Maybe the I don't know, obstetrics, o el área de obstetricia. You
Obstetric
see?
Department.
Okay,
Ajá.
a ver, vamos a analizar un poquito aquí el siguiente texto. Focus on this part. Please read the first one.
Different hospital departments provide different service to patients depending on the exact nature of their illness.
Their
Illness. Illness.
illness.
Illness. For example, a cardiology department has a staff that specializes in treating heart conditions. Radiology departments provide services such as X-rays, MRI, and CAT scans to identify and diagnose disease. Pathology departments study and diagnose disease by inspecting organs, tissues, and bodily fluids. Obstetrics provide care service to expectant mothers and their babies.
Okay, and their baby. So you say different hospital departments. Get a different hospital departments.
Um, it's different departments who provide healthcare,
Okay.
to treat, to diagnose
To
illness.
diagnose. Dice así, diferentes departamentos en el hospital brindan. ¿Qué brindan? Diferentes servicios. ¿Y a quiénes los brindan? A los pacientes. ¿Dependiendo de qué? Depending on. Mira, dependiendo de the exact nature of their illness. Dependiendo de la naturaleza exacta de sus enfermedades. For
Nice.
example, the cardiology department has a staff that specialize in treating heart. Recuerda que corazón es heart,
Heart,
no es heart, no, sino heart. Dice que el departamento
heart.
de cardiología tiene un staff que, en este caso podría ser who, que se especializa, specialize. ¿En qué se especializa? In. Utilízame la preposición in para indicar en qué te especializas. Por ejemplo, I specialize in languages. Yo me especializo en idiomas. I specialize in Japanese, yo me especializo en japonés. I specialize in maybe speaking English. Yo me especializo en enseñar inglés. En este caso, specialize in treating heart conditions, en tratar condiciones del corazón. Dice que the radiology departments provide services such as X-ray, MRI, and CAT scans. ¿Qué vendría a ser un MRI?
Mm,
Una resonancia Mac.
magnética.
Sí, se llama magnetic resonance imaging.
Oh,
Magnetic resonance imaging, ¿ok?
magnetic.
Y el CT scan vendría a ser el computed tomography scan o
Ya,
la tomografía
tomografía
computarizada.
interesada.
Yes. CT scan, el MRI. MRI, resonancia magnética, CT scan, tomografía. To identify, para identificar and diagnose disease. Pathology department study and diagnose diseases by inspecting. Dice que el departamento de patología estudia y diagnostica las enfermedades al inspeccionar los órganos. ¿Te das cuenta? O sea, me
Ujú.
indica el modo, o sea, me indica el by. Y luego del by tienes que ponerme un verbo con ing. By inspected organ. La palabra es tissues. Tissues vienen a ser los tejidos. And
Tejidos.
bodily fluids vienen a ser estos fluidos corporales.
Ujú.
Luego tenemos obstetrics. Obstetrics provide care services to expectant mothers. Las expectant mothers es como estas madres que están embarazadas, you know, and their babies. Y la última pregunta, which hospital department needs nurses the most? ¿Cuál crees tú que es el departamento que necesita más enfermeros?
Mm, I don't know.
And
Puede
the answer is
ser
the emergency department, the ER.
emergency department.
The emergency, read the sentence two. Please read the answer number two. Read it.
It seems to me that the emergency department needs nurses the most. This may be because of the technical training that nurses need to be able to deal with the emergency situations. Also, because it is impossible to predict what type of service a patient who finds themselves in the emergency room will need. Nurses need to be trained to deal with many different situations.
Por ejemplo, ¿qué es ese? It seems to me that.
Me parece que
Me parece a mí que el emergency department o el departamento de emergencias needs nurses the most. Necesita a los enfermeros más. This might be because of. Esto podría ser que era because of,
¿por qué?
debido a. El
Debido a,
por qué es
because
el
of,
because, pero because of
ok,
es debido a. Debido
debido a.
a el entrenamiento técnico que los enfermeros necesitan ser capaces de lidiar con las situaciones de emergencia. También, because it is impossible to predict what type of service and patient porque es imposible predecir qué tipo de servicio un paciente who finds themselves in the emergency room will need. Dice, porque es imposible predecir qué tipo de servicio un paciente, se encuentran a sí mismos en la sala de emergencia, necesitarán. Entonces, nurses need to be trained to deal with many different situations. Entonces, los enfermeros necesitan ser entrenados para lidiar con muchas o con diferentes situaciones. ¿Estamos de acuerdo, Josué? Yep.
Sí, sí, sí,
Okay.
sí.
Okay, so we're going to stop here. Como que nos vamos a
Ujú.
quedar aquí. El día de hoy hemos terminado lo que sea el staff. ¿Qué necesito que repases? ¿Qué hemos aprendido el día de hoy? Hemos aprendido el personal staff.
Personal
Hemos aprendido
stuff.
verbos como diagnose, treat, perform, administer. Hemos aprendido, ¿qué más? Una expresión muy útil que es el do you happen. Yo lo
Do you
uso en mi vida
happen to?
diaria. No me llama, le digo, oye, do you happen to have a piece of bread? ¿De casualidad no tienes otro pan? A piece of bread. Lo uso bastante el do you happen. Hemos aprendido la diferencia entre el of course y el I'm sorry. Ya sabes que si sientes
I'm
culpa,
sorry.
es I'm
Excuse
sorry.
me.
Si no, dice excuse me. ¿Ok? ¿Qué más hemos chequeado aquí? Tan, 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 tan. No, so
Mm,
I need to practice maybe pronunciation. Quiero que practiques cómo se pronuncia lab technician, surgeon, anesthesiologist, pharmacist, radiologist.
anesthesiologist.
Quiero que te salga de forma más rápida. ¿Ok? Did you understand that part?
Yeah, of
Ok, te
course.
voy a mandar igual todo este documento a través de la plataforma. Así que por ahora te voy a pedir que me envíes un mensajito con alguna contraseña que quieras o algún usuario. Mándame un usuario o una contraseña o yo te la creo, porque ahora para acceder ya nos están pidiendo un usuario y contraseña. ¿Vale?
Sí, de que estaba viendo ahorita que entré a la página.
Yes. Ok, entonces cualquier consulta no dudes en escribirme. En breves minutos te voy a enviar tu evaluación. ¿Ok? Del día de hoy. Trata
Ok.
de enviarlo. ¿Vale? So that would be
Ujú.
all. Bye bye. Take care. Do you have any questions before we leave the class? No, right?
No, I'm okay.
Okay, you are okay. So that would be all. Bye bye. Take care.
Bye.
Bye bye.